Today I'm going to talk about FMD vaccination, as the title indicates, our preparedness, the availability of vaccines, and the limitation of vaccines. And many of us have been working on the secure pork supply plan and secure milk supply plans, and the more I work on those, the more I am convinced that we have to have vaccine to avoid a huge catastrophe, so that it's only a small catastrophe. Without vaccine to stop FMD, we're going to be in a lot of trouble, and that's the take-home message. So in this presentation, I'm going to talk about the potential for FMD introduction, the impact, many of you know that, the response, and I'll just barely refer to the secure food supply plans. Dr. Pam Hollinger will be talking about secure milk supply plan after this. And then I'll talk about the types of vaccines that are used around the world and some of the new technology vaccines and how we might be prepared with enough vaccine. FMD vaccine is a very difficult situation. So as you know, it's said to be the most contagious disease of animals. People fighting PEDV right now might argue with that, but FMD is the most contagious disease of animals. It's the major animal disease preventing world trade in animals and animal products. The mortality in adult animals is low. Most adult animals will recover after being infected. They may not return to full productivity, but they'll recover. Mortality can be high in young animals, depending on the strain of the virus. The high mortality we associate with FMD is due to the control program. Stamping out leads to very high mortality. And the problem with FMD is it leads to persistent infection in cattle. So cattle can be persistently infected after they recover, and we have to find those persistently infected animals. The UK, Korea, and Japan were FMD negative countries that recently had outbreaks, and they were able to control them with or without vaccination. Egypt was an FMD positive country. They've been vaccinating, and then they got a new strain in that their vaccines didn't recover. And it was as though they hadn't vaccinated, because the vaccine is strain specific. And FMD is very prevalent in the world. 178 member countries of the OIE, 96 countries are endemic and have always had FMD. They've never been FMD free. 66 countries are free of FMD. There are 11 countries that have free zones, as was just described, where part of the country is free and part is not free. And maybe it's free with vaccination or free without vaccination. 5 countries in recent years were free and suffered from a reemergence of FMD. So this disease is out there and it's moving. Basically, North America, Europe, and Australia are the big regions that are free. The rest of the world, many countries have it. And the United States has had 9 outbreaks of FMD. Between 1870 and 1929, 60-year period, we had 9 outbreaks. Every one of those outbreaks was controlled by stop movement and stamping out, which is the standard way for managing FMD. And it worked great in those 9 outbreaks, where the herds were very small and very little movement. And unfortunately, FMD is a disease you can't miss. The clinical signs tell you where it's at. So that's been the way we have assumed we would control outbreaks of FMD until recent years. So the traditional response is to focus on eradication, stamping out with no vaccination. However, and the World Organization for Animal Health makes the rules for world trade, and they define stamping out. So if we're going to do stamping out, we have to do it the way they define it, and that's killing of the animals which are affected and those suspected of being infected. And it's all susceptible animals, vaccinated or unvaccinated, on an infected premises, should be killed and their carcasses destroyed. So you've got to kill all the animals on the premises and perhaps neighboring premises. And you've got to do it quickly to stop the spread of disease. So you should kill within 24 hours if you can. However, our North American animal agriculture industry is unique. The size, structure, efficiency, and extensive movement inherent in the U.S. and North American livestock industries will present unprecedented challenges in the event of an FMD outbreak. No country with an agriculture like we have, animal agriculture, has had to deal with an FMD outbreak. We have, as you know, very large operations. dairies with more than 5,000 cows, calf ranches with more than 70,000 calves from 1 to 4 months of age in one ranch, feedlots with more than 50,000 head, sow operations with more than 20,000. You just can't kill all of those in 24 hours or 48 hours. And if you could, you can't dispose of them. And we have extensive movement. It's estimated that there are 1 million swine in transit daily, 1 million pigs on trucks daily. About half of those are going to slaughter. The other half are moving between different stages of production. About 400,000 cattle being trucked every day. And then we have auction markets with extensive animal movement, fairs and exhibitions. So there's all kinds of animal movement and intermingling and going back out to other premises. So if we have a stop movement, we can issue, a stop movement order can be issued, but you've got to deal with the animals that are already in movement. So in the first 24 hours, you've got to land all those animals somewhere safely, and then not putting new animals on trucks for as long as you can. But the way our agriculture industry is set up, we can't wait very long before we have to move animals. And this has changed in recent years. This shows the in-shipment of hogs to Iowa and then to all U.S. states for selected years. So in 1990, 4.3 million pigs moved across state borders. In 2011, 40 million pigs moved across state borders, often multiple state borders to get to where they're going. And 22.5 million of those came into Iowa. So we've got very extensive movement. And if we shut the state borders, what are we going to do with all those animals? And in the large production facilities, it's a moving conveyor belt, essentially, of animals from breeding, gestation, to farrowing, weaning, finishing, and to market. So if there's 400 to 500,000 pigs going to market every day, pigs and sows and boars, and we shut down the markets and the movement, what are we going to do with all those animals that are needing to move through the system? So we can't stop movement very long unless we're prepared to kill the animals where they're at, because they've got to go somewhere. And we have a very diverse animal industry. 87% of the inventory of hogs in the U.S. are on facilities with more than 2,000 head. But there's 48,700 operations with less than 100 head of pigs. And if we have an outbreak, we have to control it in all those different sizes of operations. These have good biosecurity, pretty good biosecurity. These probably don't have such good biosecurity. And this is dairy cows. There's 43,000 dairies with less than 100 cows in the U.S. But 50% of the inventory is in dairies with more than 1,000 cows. And we have to control the disease in all of these, prevent the disease or deal with it. And then we have the role of wildlife. We've seen a big expansion or explosion in the number of feral swine and in deer in the U.S. Probably the disease FMD won't sustain itself in wildlife if we can control it in domestic animals, probably. However, these animals can be great fomites for the disease. If they're traveling between herds unrestricted, they can carry the virus and help spread the disease. So on day one of an FMD outbreak, all exports of cattle, swine, sheep, goats, and their uncooked products will be stopped, as we already heard. So prices will plummet. The price for our commodities will plummet. And there will be stop movement orders, which will need to be implemented for a period of time until we figure out where the outbreak is and how big it is. And we've become much more dependent on exports. This shows pork export value from 2003 to 2012. I haven't seen more recent figures yet, but we've seen a very nice increase in the value of pork exports. The problem is the more successful we are with exports, the more vulnerable we are to losing our export markets. And this is beef exports, 2003 to 2012. You can see what happened after the one case of mad cow disease, 2003. A case of FMD would produce a similar drop. And this is the dairy exports in 2013. Dairy exports $6.7 billion. 15.5% of the milk solids production are exported. 56% of the whey protein, 58% of the powdered milk are exported. So if we need to work to try and preserve some of those markets ahead of time, so maybe we can keep exporting some of these things. But if we lose all those exports, on day one, that's about $18 billion in beef, pork, and dairy value that goes away on day one. So how do we control? What are the tools for control of FMD? Biosecurity is absolutely essential. Stop movement has been the traditional tool to stop all movement, find the disease, and stamp it out. And stamping out, as I mentioned, where you slaughter all clinically affected and in-contact susceptible animals, preferably within 24 hours or as soon as possible. Trace back and trace forward. The OIE says the incubation period is 14 days and you should trace for 2 incubation periods. So when you find an infected farm, 28 days prior to that, the trace back is what animals came onto that farm and where did they come from. And then you've got to go all of those premises and see if that's where the virus might have been. Trace forward is for the previous 28 days, where did the animals from that infected farm go to? So you need very good animal ID and traceability, which we don't really have. And in a large outbreak, all of that tracing would be a very daunting task. We need high volume rapid diagnostics, and we need vaccination to control FMD. In vaccination, you can vaccinate to kill, where you ring vaccinate, and then you kill all the vaccinated animals and dispose of them, but it gives you a little more time to do the killing. Or you can vaccinate to slaughter, where they're vaccinated and sent to slaughter and salvaged. Or vaccinate to live, where you vaccinate and they live out their useful lives. So what do we have for vaccine? There is the North American FMD Vaccine Bank, and it contains vaccine antigen concentrate, which is the killed virus stored in liquid nitrogen, frozen in a concentrated form. And in the event of an outbreak, we need to identify what the strain is and then find that strain in the bank, send it back to the manufacturer in England or Argentina. They add the adjuvant, and they formulate it into finished vaccine and ship it back to the U.S. And this is shared by the U.S., Canada, and Mexico. And the supplies are based on the old model of very selective use of vaccine, just ring vaccination and relying on stamping out. And the USDA has said the emergency vaccine stocks are far below what would be required to address a single livestock death state or a multi-state outbreak. The actual contents of the bank are not public information, because we don't want everybody to know what we have and what we don't have. But there's not enough in the bank for a big outbreak. So in a very large outbreak, the only one of these tools we're really going to have is biosecurity. And that's going to be very difficult to implement, especially the way we move animals, and especially in the beef and dairy industries. So if we want to think about what happens with a brand new disease in a totally susceptible population where we don't have vaccine, all we have to do is see what's been happening with the PEDV outbreak, and you're all familiar with that. First case in April of 2013, and biosecurity hasn't been able to stop its spread. Now, there are a lot of differences between PEDV and FMD. It's not a reportable disease, so there's no requirement to report it. There was no control program federally mandated. But you can see when you have a totally susceptible population and no vaccine, how difficult it can be to stop a disease. So if we look at what happened in the UK in 2001, that outbreak is estimated to cost perhaps $10 billion as an estimate. And that includes the tourism figures and so forth. But the UK only had 1.7 million cattle, 2.2 million sheep, 424,000 pigs. We slaughter that many every day. Compared to the numbers in the US, so what would an outbreak in the US cost if we tried to control it with stamping out? And the secure food supply plans are the principle behind those is that the response should not cause more harm than the disease itself. And those are very long stories, and Pam will tell you about the secure milk supply later. If we compare, in 2001, both the UK and Uruguay had outbreaks of FMD. UK had a type O FMD, Uruguay had a type A. UK had 1.7 million cattle, Uruguay had 10.6 million cattle. UK did not vaccinate, they stamped out. Uruguay, after a few days, decided to vaccinate, and they gave 2 doses a month apart. So they used 24 million doses of vaccine. The UK killed 6 million head of animals. Uruguay killed 6,900 head of animals. Cost about 10 billion in the UK, cost about 243 million in Uruguay. UK became FMD free without vaccination, and you do get your trade back quicker. Uruguay became FMD free with vaccination. According to the OIE, they're still free. If they're free, but they're vaccinating, and that makes it harder to do surveillance. But it also protects them from the virus sneaking across the border and causing another big outbreak. So there are different ways to use the vaccine. Stamping out with no vaccination is the preferred method. It has to be a limited outbreak in a small number of animals. Stamping out with emergency vaccination to slaughter or kill. So you stamp out, you do ring vaccination. After you've had your last case, or you think you've had your last case, you stop vaccinating. You get rid of the vaccinated animals, so now you only have non-vaccinated animals, and you can establish your freedom more easily. Stamping out with emergency vaccination to live. You vaccinate fairly extensively, but you don't kill those vaccinated animals. So then you have to use surveillance to show that the virus is gone, but you stop vaccinating. And eventually, you stop vaccinating, you get back your free status. Or vaccination to live with no stamping out, and you just continue vaccinating for a long time. And vaccination, as I mentioned, does extend the time to regain FMD freedom. But it's going to be a long time anyway. If we look at these 5 examples, the blue is how long the outbreak lasted in those countries, from the first case to the last case. Red is how long it took for the OIE to recognize disease freedom. Green is how long it took the US to recognize disease freedom. So in Japan in 2010, their outbreak lasted about 60 days, and after about 700 days, we finally recognized they were free. So this is where you treat others as you hope to be treated yourself. And it takes extensive documentation to prove you're free, as it has to, because you don't want to take a chance of importing some virus. So in working on the secure food supply plans and trying to decide how to manage an outbreak or recommend how to manage an outbreak, it always came down to, well, it depends. Is it a small outbreak? Is it a big outbreak? So then we started putting together something we call the phases and types of an FMD outbreak to kind of categorize the outbreak and then adjust the response according to the size of the outbreak, the extent of the outbreak. And all of these are only recommendations. The incident command officials will decide at that time how to respond. They're not obligated to follow any of these plans. So the phases of an FMD response, if it occurs in Canada or Mexico, would be the heightened alert phase for the U.S. Our neighbors have it. We really need to be prepared and keep it out. Phase 1 is from confirmation of the first case in the U.S. until there's reasonable evidence to estimate the extent of the outbreak. You find one case, but you don't know what else might be out there. And phase 1 should not last more than 4 days. By the end of 4 days, we should have some idea if it's a big or a small outbreak. Phase 2 is where surveillance and epidemiology provides timely evidence of outbreak extent to support decisions by incident command. So they have some idea where it's at and how big it is. And that's the long phase of control. Phase 3 is recovery, where surveillance and epidemiology indicates FMD is under control, and we have to have a plan to recover disease-free status. We have to do surveillance on all of the susceptible animals within the affected region to prove that they aren't harboring the virus. Phase 4 is U.S. is declared free of FMD, possibly with vaccination, and we have to convince our trading partners that we really are free, so they'll start buying our products. During Phase 2, which is the period where we're fighting to control it, we've described what might be 6 different types of FMD outbreaks. Type 1 is a very focal outbreak. And at the beginning, you have to assume it's going to be a small outbreak until there's proof otherwise. And you pull out all the stops and stop movement, stamping out, do everything you can to stamp it out while it's still small, hopefully. Type 2 is a moderate regional outbreak. Type 3 is a large regional outbreak. And at this point, you can't stamp out. You can't kill enough animals. So this is basically on what's possible. By a large regional outbreak, it becomes impossible to stamp out. The response to FMD will be managed by the Incident Command System, which was developed for managing forest fires. And that's a pretty good analogy. If you're fighting a forest fire and it threatens to blow past you, you need to come up with a new strategy. So that's sort of what this is, to help think through different strategies. Type 4 is a widespread or national outbreak. Type 5 is a catastrophic U.S. outbreak. Type 6 is catastrophic North American, where it's Mexico, Canada, and U.S. So let's look at the Type 5. If we don't have enough vaccine and we can't get it under control when it spreads like PEDV has, widespread areas of infection are detected involving a large portion of the U.S. Too many animals are affected to implement or continue stamping out. Sufficient vaccine and resources are not available to effectively use vaccine to control the outbreak. It becomes apparent that FMD is widespread and will not be eradicated within a year. So we transition from an emergency eradication response to a long-term control program, eventually leading to eradication, like the Brucella program, TB program, and so forth, perhaps including vaccination to live. So now let's talk about vaccines. FMD vaccine is a complex vaccine situation, much more complex than other vaccines. We developed for the National Animal Health Emergency Management System an appendix on FMD vaccine. It gives a lot of literature review and ins and outs on FMD vaccination. It's available on the website if you're interested. And I'll just go through a few factors. Vaccination protects from clinical signs of FMD, does not prevent infection and establishment of persistent infection in cattle. So vaccinated cattle can get exposed, not show clinical signs, but become persistently infected. Reliable detection of persistently infected animals delays return to FMD-free status. But there's no evidence that these persistently infected cattle can transmit infection under natural conditions. But still, you don't want cattle that have FMD virus in their pharynx, even if they don't transmit it. So we need to find those. So we want to use vaccines that are DIVA vaccines, that allow the detection of infection in vaccinated animals. So any vaccine we use in the U.S., we want to be a DIVA vaccine. It's a marker vaccine, kind of like we use for pseudorabies. They do not induce the current kill vaccines used around the world, some of them used around the world, do not induce antibody to non-structural proteins in the virus. Infection with the actual virus does induce antibodies to non-structural proteins. So the surveillance has to be done where we test for antibody to NSP. And it's a herd-based surveillance, not an individual animal surveillance. So you test herds. If they have antibodies to non-structural proteins, then that means that the virus is circulated in that herd. Big problem with FMD vaccination is there's 7 distinct serotypes that are not cross-protected, and about 65 subtypes. And cross-protection between the strains within a serotype is not always present. So not even within a serotype do you always get cross protection. So in an outbreak, we have to isolate the virus and identify the serotype to select the correct vaccine. It's not like most of our other diseases where there's one strain and one vaccine. It's a little more like influenza that way. And the World Reference Laboratory for FMD in Pirbright, UK, annually or even more frequently than that, makes recommendations on strains that should be in the National Antigen Bank. There's 24 different strains that are recommended to be held in the vaccine bank for any country that wants to be ready. High priority, medium priority, and low priority, as you can see. So there's a recognition that we don't have enough vaccine. And in 2004, Homeland Security Presidential Directive 9 was issued. And that directed the Secretary of Agriculture to establish the National Veterinary Stockpile, which is supposed to be a national repository of critical veterinary supplies, equipment, and services. And it requires the NVS to deploy within 24 hours sufficient amounts of animal vaccine, antiviral, or therapeutic products to appropriately respond to the most damaging animal diseases affecting human health and the economy. So 10 years ago, this was mandated by a presidential directive. And a group of government experts decided what are the highest priority for the stockpile, and that's recently been redone, but foot and mouth disease has always been near the top of the priority list, along with others that are on the priority for having countermeasures. But the National Veterinary Stockpile has been funded at about $2.5 million a year since it started, approximately. And there's about 10 diseases that are recommended to have vaccines for this many animals at $2.5 million a year. It's been mandated, but Congress has never adequately funded the stockpile. So there's increasing concern about not having enough vaccine. I was asked by the National Pork Board, the National Cattlemen's Beef Association, and the National Milk Producers Federation to produce a white paper on FMD vaccine surge capacity for emergency use in the United States. And we developed that white paper. It went out for review to a number of experts and to USDA and DHS and some others. We got the comments back, we finalized it, and put it out on January 9th of this year. It's fairly extensive, but there's an executive summary, so you don't have to read the whole thing. And it's available on a website. So where could we get enough vaccine if we needed it in a hurry? If we don't have it in our North American bank, and we don't have it in the National Veterinary Stockpile, how could we get enough? And that's the point of that paper. How could we get enough? Well, one source would be international commercial manufacturers of killed FMD vaccine. There are no companies in the U.S. producing killed FMD vaccine because it's not allowed. To produce killed vaccine, you have to grow virulent virus in very high titers. And there's a danger of escape from the manufacturing facility. There have been 15 escapes in the last 50 years from vaccine plants around the world. The most recent outbreak in the UK was from a vaccine facility. But more doses of FMD vaccine are used in livestock worldwide than for any other disease. So it's the most common vaccine produced for animals. And these international manufacturers, there are a lot of them. It would be nice if they were USDA tested and permitted for importation to meet the same standards as other USDA licensed vaccines. So that if we have to use the vaccine, we can tell the public this vaccine meets all the same potency, safety standards as all the other vaccines we use in food-producing animals. You don't need to worry about eating the meat and drinking the milk. It's just another vaccine that USDA says is safe and effective. There's only one company in Argentina that is permitted for importation and sale, and the USDA has inspected. fact, last week I was in Argentina doing an inspection with the USDA of this company. The second, they got their permit in 2011. This was a reinspection. You have to do it every 2 or 3 years. And they passed just fine. But there is in the Federal Register a potential for emergency exemption from licensure. So the Secretary of Agriculture or APHIS administrator, somebody up there, really high, can make an exception and import vaccine under an emergency exemption from anywhere they want to. But there's a lot of concern. What if that vaccine is made with serum from a country that has BSE, bovine serum from a BSE positive country? What if they don't irradiate their serum? How do we know the safety and efficacy? Even if it is perfectly safe and effective, but it hasn't been CBD licensed, how do we assure the public that it's a vaccine that is not going to cause any problems and will be effective? So we reviewed, in that paper, we reviewed the existing killed vaccines, the advantages, disadvantages of those. Then there are new technology vaccines that show a lot of promise. New vaccines under development. They could be safely manufactured in the U.S. because they don't use whole virulent virus, and which are based on a platform that allows various capsid serotypes or topotypes to be inserted into the vaccine. So if you have 24 different strains we need to have a vaccine for, then you have to have 24 virulent isolates to make a vaccine from. Or these genetically engineered type vaccines where you just insert the cassette for the protective epitopes of each of the 24 strains. And you've got a safe vaccine that can be manufactured in the U.S. And is quite versatile. One of these, the human adenovirus 5 vectored FMD vaccine, has been conditionally licensed by the USDA. It's not under commercial production yet. And there are efforts to add new strains besides the one strain. There's a leaderless killed FMD-3D vaccine that the research was done at Plum Island. It looks like a real likely candidate. There's more work that needs to be done. Alpha virus vectored FMD vaccine that Harris Laboratories is working on, and a plasmid DNA FMD vaccine. So these are all under development. They all still have some development that needs to be done to prove that they will be safe and effective and can meet licensure, but there's a lot of promise with these vaccines. So how could we be ready with enough vaccine for 90 million cattle and 60 million pigs with 24 different strains of virus to meet an emergency need? Well, we would want enough vaccine to be immediately available so that as soon as we know the strain of the virus, within 24 to 48 hours, we could bring in a few million doses and start vaccinating in the area, if that's the decision. So that could be finished vaccine held in vendor-managed inventory and ready for shipment within 24 hours. So a vaccine company that makes 150 million doses a year for Argentina, for example, could keep X number of million doses in their refrigerator at all times. As they make a new batch, they sell what they've been holding for the U.S. So they always keep 10 or 20 million doses ready to send to the U.S. Within 24 hours. You have to pay them to do that. That's going to be kind of expensive. But then you have vaccine that within 24 hours we could get however many million doses we pay them to hold for us. And it never expires because they just rotate their inventory. So that would be immediate availability for hopefully maybe the first couple of weeks. Short-term availability then, that could be available within 10 days or 2 weeks, could be vaccine antigen concentrate held in vendor-managed inventory ready to be formulated into finished vaccine and shipped to the U.S. So again, these manufacturers can grow their vaccine virus, kill it, and store it in liquid nitrogen, ready to be formulated into finished vaccine. And in liquid nitrogen, these viruses last for several years. Then as it begins to get older, they could formulate that into vaccine and sell it to their regular clients and produce new antigen concentrate. So they're rotating their stock of antigen concentrate. And maybe we could have enough of that for the first 2 or 3 months. So from like week 2 until month 3 or 4, several million doses, or tens of millions. And then long-term availability. After those are exhausted, we would want vaccine production initiated at the beginning of the outbreak for the specific outbreak strain. We know which strain it is, or maybe it's 2 or 3 strains. And they start producing it because we know we're going to be needing it in the future. And that probably takes 3 to 4 to 5 months before we can have newly manufactured vaccine ready to go. So we could enter into contracts with international manufacturers of FMD vaccines for surge capacity production of the vaccine that they already make and use around the world. And if we get the new technology vaccines, if they prove to be as safe and effective as we think they might be, then U.S. companies could gear up and manufacture vaccine on the mainland using these new platforms. And again, that would take a few months probably. So there are ways we could have enough vaccine, but it's going to be quite expensive to have that. So what we need is to secure the funding from somewhere to be able to have those vaccines to avoid FMD becoming widespread throughout the U.S. and endemic, essentially. So we can meet the mandate in Homeland Security Presidential Directive 9. And one estimate is about $150 million a year for 5 years, and we could perhaps be where we need to be. That's a lot of money, but it's a $100 billion a year animal industry that we would be trying to protect. And then where do you find that money in this current environment? And that's a job for all of you to figure out where that money can come from so that we can be ready for an FMD outbreak. So a lot of these documents are available on our website, the Secure Food Supply Plan, several FMD documents, or you can just Google Secure Food Supply Plans and find these documents on that page. So I think I left some time.
Yeah.
Okay.
Take some questions.
So questions? Comments?
Does it take 2 doses to get effective protection?
So does it take 2 doses to get effective protection? Depends on the potency of the vaccine. If you have high potency vaccine, outbreak potency, 1 dose is supposed to give good protection for a few months. And then in 6 months come back with the 2nd dose. Lower potency vaccine or uncertain potency, you probably want to vaccinate 2 doses 1 month apart. So for 90 million cattle, that's 180 million doses, plus the pigs.
Is that price of $150 million a year, 5 years for 1 serotype? Or?
No, that hopefully, I made that number up. But I did some calculations, and that should provide, if we could find the sources for all the recommended 24 serotypes. And I would recommend the high priorities have more doses stockpiled than the lower priorities, probably. But that should make it available.
Do the commercial producers around the world of the vaccines already produce multiple serotypes?
So
That many?
the commercial manufacturers around the world produce serotypes for the strains that are a big problem around the world. They produce for their region. So yes, they do. There may be some minor strains that nobody's producing for because they don't show up very much. The problem with going to the commercial producers is they are producing at capacity for their existing customers. And if we go to them, like the Argentina company we're working with, everything they produce is for their existing customers. And we can't go in and say, okay, we want your vaccine now because what they have is for their customers. You know, they aren't producing extra just in case. So you have to have these vendor-managed inventory contracts in place. John?
In your draft document, why you reference advisory boards or committees that meet, have they been formed?
Okay, one recommendation in the document is the U.S. should have an advisory board of FMD vaccine experts, production animal agriculture experts, to recommend who gets the vaccine. You know, we aren't going to have enough at the beginning. And I like to say that in the North American Bank, there's just enough vaccine to start really fights about who gets it between U.S., Canada, Mexico, and the different states. We're going to need some group to decide how best to use the limited vaccine available. Where can we get the most bang for the buck for what vaccine we have? And no, there hasn't been a board like that appointed that I'm aware of.
Wouldn't that board also give advice on stockpiling and direction from that group?
That would be optimal. If we had a board now, and commodity groups would need to be represented, that could begin to provide advice on do we need vaccine and how much do we need. I think Dr. Annette Jones is forming a group with NIAA and USAHA to begin that, but I'm not sure if that's formed yet.
Looks like that'd be a good
Program
for this year.
to help push for it.